All right, ladies and gentlemen, we are here with Miss Chelsea French with our Injustice interview. Miss Chelsea has been battling diabetes for a lot of years now, and currently she just came out of open heart surgery about 3 weeks ago.
Last month, yes.
Yeah, last month. And so we will let her give her story and see how you can help.
Well, as I said, I've been diabetic since I was 13. I am now 34. I will be 35 in September. So I've been battling type 1 diabetes since that young age. When I was 29, my kidneys failed, and I've been on dialysis now, going on 6 years. I am currently on a transplant list at VCU to get a kidney and a pancreas, so I would no longer have the diabetes or the renal failure. In the midst of that, I had past couple of months I had situations where I went to the ER. I was coughing up blood clots. I was turned away from the hospitals and was accused of coming there for drug seeking. And these are some local hospitals here in the Hampton Roads area. And this went on for 3 months. I was coughing up humongous blood clots. They were just telling me it was a blood thinner that I was on, which was not true. I had endocarditis in one of my heart valves, and I had taken an antibiotic for it. The hospitals assured me once I finished it that I was no longer suffering from that infection, which was not true. So by the time we got to this most recent stay, they had to transfer me to VCU. My heart valve was leaking blood, and it was filling blood up in my lungs. That's why I was coughing up those clots. It wasn't because of a blood thinner. I feel that if they would have did their due diligence and don't always think that you're coming there for drug seeking purposes, they probably would have paid more attention to what was really the issue. I wasn't coming there for drug seeking or to be medicated. I wanted to know why I was coughing up these humongous blood clots for so long. By the time they took that valve out, it was depleted. I have a mechanical valve now in my chest. They weren't able to grow anything from those cultures. So the infection was there still, even though I was told it was gone. I still had endocarditis. It wasn't gone. So the malpractice, I have to do something. It's worrisome, it's tiresome going to these ERs and you getting turned away because you need help. And then people don't look at you as needing help, that you're there for some other type of reason. To get high or whatever. I understand some people do that, but that was not my situation. They don't look at my past, my medical history, anything. They just come in. Some of them won't even examine me. First thing they say when they walk in the room, they don't ask me how I am. The first thing they say is, "You're not getting any narcotics." Don't ask me why I'm there for anything. They don't get a pulse, listen to my lungs. They don't do anything. They won't even sometimes come out of the doorway. That's the first thing they say when they enter in the hospital room, in the ER. It really does discourage anybody, even myself, to want to go there and get any help. Because of the situation with my heart, I have been made inactive on my transplant list. I've had 14 offers for kidney pancreas transplant since Thanksgiving of last year. I wasn't able to get them because the pancreas was not healthy. They want to do both organs from the same donor. So I've had 14 offers. Now, because of this situation with the malpractice and them not doing what they needed to do in these ERs and at these hospitals that I went back and forth to for 3 months, now I gotta wait additional time. This has to clear up before I can even made active again on my kidney pancreas transplant. This is putting another halt on my recovery. This is no way I want to live. I've been doing this 6 years, going on 6 years. I'm 34. I don't have any children. I don't do anything like that. I deserve more, and I don't deserve to be treated like that at these hospitals. I'm just asking for help, because when I do get my transplant, and I say when because I am going to get it, just to obtain the organ, you have to have almost $3,000 a month for anti-rejection drugs. My Medicaid and Medicare, it only covers for 1 or 2 years. After that, it has to be out of pocket. And even prior to that, even though they cover it, those transplants facilities, the hospital won't. I need to have proof that I will be able to maintain the transplant. They're not going to give it if I don't have the money to have my anti-rejection drugs. I can't miss a dose. If I do, those organs will reject. So I just ask for help. If you find it in your heart, if you have anybody that's going through it, it's not easy. My main support system is my mother. My mom's 70 years old, and I'm telling you, I wouldn't be here if it wasn't for her. Even with this recent hospital stay with my heart, those doctors wanted her to leave. I had to fight for my mother to stay with me because they weren't checking my blood sugar, sugar below 30. And they weren't scheduled to come in and see or check or do anything on me. If my mom was not in there, I would have died. She is my support system. My father just passed away 2 years ago. And
tell me what happened when she did leave you in the room.
Oh, when she did?
Tell what happened.
This was right after my surgery. I had a breathing tube down my throat. And it was 8 a.m. This is at VCU. They told my mom she had to leave. I was supposed to have a nurse babysitter there. They call it a babysitter. They sit in there the whole time. And this breathing tube, I have a very high tolerance where anesthesia and those type of things don't last on me. And I was awake. They had my hands strapped to the bedposts. I was totally refrained. I couldn't move my arms. And I was choking. I was vomiting. But I had a breathing tube down my throat. So I couldn't make any noise. I had to get enough slack to try and bang on the bars of the bed. And those nurses, they were in the hallway laughing, talking about what they were doing the weekend. She came in there and the respiratory nurse said, "Stop being dramatic. Stop fighting the tube." And I'm sitting there with tears in my eyes because I'm choking. And they wouldn't let my mom. If my mom was in there, that would never have happened. That nurse was not supposed to leave me unattended, and she did. Not to have, if they do leave, they have to have somebody come and recover, take their place while whatever they have to do, use the bathroom. None of that was done. I was sitting there. I suffered from claustrophobia, so me being restrained was another. It was a lot of anxiety I was having.
Triggered.
But yeah, it triggered me. Definitely triggered me. And the fact that they're just stop being dramatic. They just had their chest opened up. I just had my heart valve taken out of my body, and I got a machine in me now. It's metal. I have a card I gotta walk around with to go through a metal detector. This one they say it doesn't have to be replaced. This type of valve I got, they did offer me to have another one which was made from pig skin. I did not go with that one. That one you would have to have replaced every 5 to 10 years. So I did go with the mechanical valve. But all this could have been avoided had the issue been addressed when I was going to those ERs and someone actually doing what they were supposed to do their job, instead of thinking I'm coming there to get high. They probably could have caught it, and I could have had other antibiotics and got rid of it. This was the only way. When I got to VCU, they told my mother I had a week, if at most a week. 3 days to a week of living. Had I not gone back there, I would have died. Because everyone was just saying, oh, it's your blood thinners. For 3 months. That's a lot of time to have an infection. So bad that when they saw it, my valve was just, it was gone. The bacteria ate away at it. I should not have to do this. No one should. When you go to a hospital, you should be taken care of. Because some days I come here and I'm like, I know people are fighting COVID. They go there. And sometimes I'm like, you know what? I'll tell my mother, let's just go home. But what if that was the case in this situation? And I said, you know what, Mom? Let's just go back home. They say it's my blood thinner. I may not have woken up. It has to change. They, like my mom says, color of care. Unfortunately, when they look at skin tones and stuff, certain races get better treatment. I'm biracial. They always think that someone's going in there, especially if you're a person of color. I know I don't have that much, but I am biracial. My mother is Black and Native American. My father was Caucasian. We used to have my dad take me to the ER. My mom used to tell my dad, rest his soul, take her because she'll get the care she needs. And this a specific doctor. I'm not going to say where. I know they're at Riverside Regional. But my dad left. And they saw my mom. My mom was going to take over watching me. Once they saw my mother, the care totally went out the window. They would give me everything I needed and never questioned me, never threw, oh, you're drug seeking, before they saw my mother. It's not, that's crazy. We're in 2022. Ain't nobody 100% of anything. Like my mother told Jafari, we're chop suey. Mm-hmm. We're chop suey. We got everything. No one needs, we're human beings. We all bleed the same. We all bleed red. It shouldn't be that one race gets treated better than the other and that you got to try and manipulate because you know how they'll look at you. My mom and my dad should never had to have my dad, just my father, go with me to a hospital because that's how I would get adequate care. It never should be that. It has to stop. I'm just asking for you guys to help me if you can. If not, pass this video along. Maybe it'll help somebody else going through it. Because a lot of the times, you feel alone. I've known Jafari a long time. And he's seen me fight for a long time. He's stayed in a hospital room with me years and years ago when it was just my diabetes. Now I go through kidney failure. He's still there. It's not right. And the fact that it's been these over, 9 years now, that we still have to fight the same battle with these people is wrong. These hospitals is wrong.
Yeah. So y'all, we'll be starting our we have a Healing for Chelsea. We'll put in the link under this for her GoFundMe. We're also starting a diabetes support group. So if you're going through these and you have these stories, unfortunately, we are running into more and more people that's going through this, and our ultimate goal will be to open a Black health care center because they don't care about our health, and even specifically a Black women's health center because they do have special needs. It needs to be one, just like there is a cancer special center, just like there's a diabetes special center. We melanated have a special needs, and we have diets and things of that nature that are passed on. So again, we'll have her GoFundMe link in this and ways that you can support her, and we will have her support page up soon. Until then, I will just keep Chelsea in your prayers. Hey Cisa, I see you checking in. But this is Chelsea, and this is who we were on the phone with last week, and we're trying to get her more help, and going through the ringers at the hospitals shouldn't be happening. And I myself experienced that when my grandmother was on her last days, on the way the doctors talked to my family in her final hours. Nurses and stuff, we understand the job is stressful, but you can't talk to people all types of ways, and you can't assume stuff, and you're not feeling that pain. So maybe we need to come up with even a mediator, because nurses are stressed. Maybe we need a third party to come in and say, hey, well, this patient really is this and this, and then they'll meet in the middle. They have all the patient's charts and everything, so it'll be smooth and nobody's violated. So
yeah, and they need to understand everybody is different. People, we all suffer different. We all grieve different. We go through things different. We're not all cookie cutter, straight textbook. That's where the doctors fall. That's where they fall short at. They think everybody is the same. And this, I can honestly say, I've had a few surgeries. This heart surgery was the most painful one I have ever underwent. To the point where I wasn't sure I was going to leave with my mom. And she saw me throwing up. We didn't know if I was going to make it through that. She even said, "You look like you were about to die." She was praying for my life. And once we get that understood, that everybody's different. Not everybody's pain tolerance is the same. And people doctors, they lose their compassion. They don't have any bedside manner. And it's just a job. I'm just a paycheck. And that's not how it should be. I'm young. I don't want this to be the end of my life. Me going through this. I want to actually live it. And not just evolve and deal with what I got to go through. I go to dialysis 3 times a week for 5 hours at a time. Just so I can put shoes on because I'm swollen. And if I go to the hospital, they send me home. Just because they're like, well, you have dialysis tomorrow. But they'll send me home with 10 liters of fluid on me, knowing I just had open heart surgery. I can't have that. That's all going around my heart and in my lungs. But that's not good enough for me to say I need it. They have to approve it. To have my life in other people's hands. I can't have no control. This is me trying to take control. I have to take control because they will kill me. They will kill me if I don't do something. So I thank you, Jafari.
Thank you. We're here.